Hello, good afternoon, everyone. Can you hear me? Okay, welcome. Thank you for joining us at e-KLESF 2022. My name is Izzat Ismat from University Tunku Abdul Rahman, Utah. Today, we are presenting a webinar titled Updates on Injury in Sports by Mr. Muhammad Noor Zulkifli bin Muhammad Jamali. Mr. Noor is a lecturer and the head of Department of Physiotherapy, M. Kandia Faculty of Medicine and Health Sciences, University Tunku Abdul Rahman, Utah. Just a little housekeeping before we start. If you have any questions, please type them into the chat box. We will bring them up during the Q&A session at the end of this webinar. All participants, please sign in your attendance in the link posted in the chat box. Without further delay, let us turn the time over to Mr. Noor.
Thank you very much, Mr. Izzat. All right, hi everyone. My name is Muhammad Noor Zulfikri. By profession, I'm a physiotherapist, and now teaching in the University Tunku Abdul Rahman. Okay. Please give me a moment. I'm sharing my screen. Thank you very much, everyone, for choosing to spend your Saturday afternoon with me here. All right, listening to the updates on the injury in sports. All right, without further ado, okay, we will go through the updates on the injury in sports. All right, so we will cover the definition and classification, the updated one, and the implication of sports injury, risk factors, prevention, and the management of sports injuries. Right. Why this is very, very important is because in the recent years, right, the past 10, 20 years, we've seen a spike number in participation in sports, all right, at all levels, whether it's children, adolescents, and also adult athletes, all right. So because of more people are participating in sports, all right, more people are exposed to sports injuries. All right, and we can see also from the recent data, all right, the number of injuries, all right, related to sports are also increasing. All right, and it is not only limited to specific group age. All right, as I mentioned, it's all layer of people who is participating in sports. All right, and whether it's elite athletes or whether it's recreational athletes, or some we call it as a weekend hero, right? They only play football or participating in sports, playing badminton on the weekend. All right, so therefore it is important for all of us, all right, to know the overall overview, all right, overview of the sports injury and its updates. All right, okay. So what is a sports injury? All right, so we can define sports injury as a damage to the tissue, all right, of the body that occurs as a result of sports or exercise. Okay, the key point here is damage to the tissue. All right, and the second one is as a result of sports and exercise. Therefore, it's not only limited in participation of sports. All right, it is also covers, right, whoever doing exercise and injured in result of doing exercise. Okay, so in a broad classification of sports injury, we have acute and chronic injuries. Okay, this classification is quite different from the injuries that is defined in other fields of medicine. All right, for example, acute injuries in orthopedic, for example, it means different things. Acute means the time frame. All right, for example, 2 to 3 weeks considered as acute, while chronic is a prolonged injuries. All right, while in sports, all right, and the term is different, where acute means there's a sudden trauma to the previously normal tissue, all right, that cause injury. All right, and for chronic, all right, it is an the occurs over a period of time, usually due to excessive or repetitive loading to the tissue. All right, so in sports injury, the classification is based on the nature of the injury, not the time frame of the injury. Okay, so this is important because, all right, these two nature of injury requires different prevention strategies, all right, and also they have a different management, all right. Okay, moving on to the implication of sports injury. What happens if one athlete or individual is injured, right? It will affect the athletes or the person itself, all right? For example, from the biological, psychological, as well as sociological impact, all right, area. All right. For example, in biological, all right, the athletes will experience pain. All right. For example, if they have an injury to the knee, they will have pain at the knee area. Right. Swelling. Right. Limited range of motion, meaning that they cannot fully bend or fully straighten their knee. This will impact also the psychological of the athletes or the person. They will feel sad, depressed, and fear of re-injury, right, and so forth. Right? And it also affect the sociological aspect of that individual. For example, they cannot go to work, cannot go to school, all right, cannot participate in events, all right. Uh, if they are injured athletes, they cannot contribute to their team, all right, and they have to be at the side bench, all right. They will be bench, right? They cannot play, and they cannot train, or they cannot compete, all right. And that is the impact at the personal level, the athletes or the individual itself. Now we will look at the other implication of sports injury, for example, to the club or to the team. Okay, if one athlete is injured, they cannot train and they cannot play for their clubs. Therefore, all right, the club lose their first is the key player, for example. Right, therefore, it will reduce the performance of the club overall. Okay, and then the club has to pay for the rehabilitation of the athletes to complete their rehabilitation. It is also it will impose a huge amount of money. All right. Okay, and then the club also has to still to pay the what do you call that, the salary of the athletes. Even they are injured, they cannot play, they cannot contribute to the club. All right, but clubs has to still pay the salary. Okay, and this will definitely impact the club overall. Okay, and the final one is to the healthcare system. All right, for example, the injured individual is not an athlete, is not working for a club or a team. All right, instead they are, for example, like me, a lecturer, right? So I'll seek rehabilitation or seek medical advisors from the government hospital, for example. All right, if more people like me, all right, go to the government hospital, definitely the government hospital queue will be long. All right. Okay, and each treatment that I get is covered by the taxpayer money. So somehow it is causing an overburden to the healthcare system. All right. So one injury can cause a lot of effects. They have uh, effects to the multiple layer of the organization. All right, not only to the athletes but to the uh, other people as well. All right, so it is very important. All right, we try our best to reduce the prevalence, the frequency of injury, so we can save all of this financial reduce performance and so forth. Okay, so why is athlete can have a higher risk of injury compared to the other? All right, in general, right, everyone has a risk of getting an injury while playing sports or exercising. Right? All of us, whoever participated in exercise or sports, they will have increased risk of injury. However, all right, the differences is the risk of injury for each individual is different. Some will have higher risk of injury, all right? Some will have a lower risk of injury. So what determine this? What factor determine this risk, right? So there is no one single factor that can be point out, right, that is causing the injury. All right, injury in sports is a multifaceted phenomenon. What do I mean by that is, all right, we cannot say that only one factor is causing that injury. All right, it is a multiple layer of factors. All right, there's a lot of factors working together in a very complex way that is causing the injury. Okay, but don't worry. All right, I will go through with you some of the key factor. All right, on how we can control the risk factor to reduce our risk of injury. All right, it is almost impossible to say that we can prevent injury, right? Because it is a multifactorial phenomenon, right? But we can control each and every of the risk factor to reduce the risk of getting injury. Okay, so as you can see in the slide, there's a lot of factors that are I've listed here, but it is not only limited to this. There are a lot of other factors as well. All right, so what we can what I will do here, I will go through all with you the sub classification of the risk factor. All right, so you have some idea on what risk factor that can be controlled, all right, to reduce the risk of injury. All right, and first is the internal versus external risk factor. All right, what do I mean by internal and external risk factor is internal is factors that is related to the athletes themselves, all right, to that individual at the personal level. All right, and external factor is the factor that is coming from outside, from the external. All right, for example, internal factor is the physiology of the athletes. All right, for the external factor is the opponent. All right, they can also cause an injury to the athletes. They will, for example, the athletes tackle. All right, by is being tackled by the opponent, that is causing the injury. That is considered as the external factor. All right, and next sub classification is we have modifiable versus non-modifiable risk factor. What do I mean by this is modifiable is something that we can modify, we can control, we can change. While for the non-modifiable risk factor is something that we is out of our control. For example, for modifiable, we can change the our strength, right? For example, we are weak in certain part of the body, so we can strengthen that. All right, for the non-modifiable risk factor, all right, for example, the opponent behavior, right? They are aggressive, all right, so we cannot control that one. All right, and or the other examples are the weather. All right, we cannot control the weather. All right, for example, if it's raining, it's slippery and it increases the risk of injury. Okay, so these are the some of the risk factors, the sub classification of the risk factor. All right, and you have to remember that the modifiable and non-modifiable risk factor, all right, also related to the internal and external risk factor. For example, we have internal risk factor that is modifiable and internal risk factor that is non-modifiable. For example, for modifiable internal risk factor is the skills, our skills, all right, the athlete skills, all right, it is coming from the athletes and it is modifiable. All right, we can train that. All right, while for the non-modifiable internal risk factor is for example, the gender. All right, we cannot change the gender of the athletes. All right, if they are female, all right, they have a certain risk of injury. If they have male, they have a certain risk of injury, so we cannot change that already. Okay, and for the external risk factor that is modifiable is the equipment, for example. All right, for example, the athlete is wearing a worn out shoe. All right, the athlete has been wearing that shoe for 5 years, for example. All right, and this because of its worn out, all right, the wear and tear effect of the shoe, all right, it will make the athlete's body mechanic change. All right, it will alter the body mechanic of the uh, biomechanic of the athlete, so it increases the injury. So that is modifiable external risk factor. We can easily change the shoe, all right, to reduce the risk. And for the non-modifiable external risk factor, as I mentioned previously, the weather, the behavior of the athletes, or the referee themselves, all right. If the referee is strict, all right, he did not allow any aggressive tackle, all right, it will reduces the risk of injury. If the referee are more lenient, all right, he allows aggressive tackle and so forth, all right, it will increase the injury risk injury. Okay. Okay, so I highlight this is the internal risk factor, all right, internal risk factor, or we call it also, it is also known as intrinsic factor, right? It carries the same meaning, intrinsic, or also known as internal risk factor. All right, I've highlighted the modifiable internal risk factor here. All right, let's go through the internal risk factor. All right, we have age. All right, age is something that we cannot modify. All right. Alright, for age, alright, each age group has their own risk factor. For example, the child and adolescents, alright, they are not a mini adult. They have different physiology, right? Meaning that they have what happened in their body is different from the adult. Alright, so we cannot have the same training for the child and adolescent as we have for the adults. So it should be different. All right, and this is non-modifiable. We cannot control the age. All right, and as I mentioned, this age group should not be having the same amount of training, same training. It's because child and adolescents, their body, all right, is not matured yet. It's not mature yet. It is still growing. All right, and because of this they have lack of strength. All right, the strength is not as strong as the adult athletes, therefore it increases the risk of injury. All right, and they are not as fast as the adults. They cannot run as fast. All right, they cannot generate the same amount of the of strength or power if compared to the adult. All right, therefore they have their own risk of they have their increased risk of injury. All right, and I would like to highlight here, all right, the concern now is the adolescents that is turning to the adults. All right, okay, although they are older than the child athlete, all right, they have lesser risk of lesser risk of injury, but when they are transitioning to the adult squad, for example, all right, usually from 17 to 18, right? When they are no longer eligible to play in the junior team, right? They have to move to the adult team, senior team, all right? And there are a difference between the volume, the intensity of these two groups, right? Usually the adults team will have lesser training compared to the adults athlete. So when the athletes, adolescent athlete, move from the junior team to the senior team, all right, they will have increased risk of training, all right, and they will have also increased risk of getting injury. All right, so this needs to be controlled. All right, the physiotherapists, the doctors, the coaches, the athletes themselves have to understand this process. Okay, all right, next one is the on the same note on the age. All right, although we cannot control the age, all right, but we can control the amount of training that they are doing, especially during the transitional phase between the adolescents team, the junior team, and the senior team. Okay, next one is the physiology factor. All right, I highlighted in yellow, meaning it is modifiable factor. All right, okay, for example, lack of flexibility. All right, lack of flexibility meaning that for example, the knee cannot be straightened in full or cannot be bent in full. All right, we need to understand what is causing the lack of flexibility, whether it's tight muscles, whether the bones are different. All right, so we need to investigate these causes, and then we plan for the intervention, we plan for the exercises. All right, next one is the muscle imbalance and muscle weakness. This always come together. All right, um, uh, we have what we call as a ratio between the front part and back part of our body. For example, for throwing, right, it requires a same amount of strength for the shoulder, front shoulder and the back shoulder. All right, this is what we call as the balance. All right, if it's imbalance, for example, usually, all right, the front part will be stronger and not only limited to the shoulder. The knee is also the same. All right, and the core, our core, all right, really we have big six pack, right, but our back muscles is weak. All right, usually the front part will be stronger than the back part. All right, and this cause imbalance and increase the risk of injury. Okay, all right. Next one is fatigue. All right, fatigue means that it is defined as the inability of the muscles to generate the same amount of strength as it's in the non-fatigue state. Meaning, when it's fatigue, all right, our strength will temporarily reduce. Right? When they are reduced in strength, it will increase the risk of injury. As we can see in football, all right, a lot of injuries occurs at the late stage of the first or the second half. Meaning, if we are playing 45 minutes, right, in each half, all right, in the last 15 minutes, they will have higher risk of injury, right? And that is where a majority of the football injury occur in the last 15 minutes of each half. All right, so this is contributed by the fatigue. All right, when they are fatigued, muscle strength is not there. All right, and then they are injured. Okay, and then we have let's go to the anatomical factor. All right. All right, we cannot change the sex as I mentioned previously. All right, we cannot change the height. All right, but we can control the body composition. All right, we can control our BMI. We can reduce the level of the body fat. All right, we can increase the level of lean muscle. All right, this one we can control and it will reduce the risk of getting injury. All right, and next one, the last one is poor biomechanics or malalignment. Right. What does this mean is it is closely related to the correct technique in performing the sporting activities. For example, all right, if they are doing a smash correctly, all right, versus if their smashing technique is wrong, all right, that will increase the risk of injury. All right. So not only the what do you call that, the body composition, all right, the strength of the athletes, all right, but also the correctness of the technique also play a very important role in reducing the risk of injury. All right, so these are the external risk factor, or also known as ex extrinsic risk factor. And that is a factor that is uh, not related to the athletes themselves. That is, for example, the training errors. Right? Right. I've given the example previously when there's a transition from the junior team to the senior team. All right, they will have increase or excessive volume, frequency, intensity of exercise that will increase the risk of injury. All right. For example, last time we have just recently we have a Standard Chartered Marathon. All right, for those who are regularly training, they have no issue in this marathon. However, for the novice runner, all right, they do not regularly do their training, but when it's closer to the event, all right, they will significantly increase their training load, all right, to prepare for the actual event. This significant increase in training load will increase the risk of injury. So therefore, all right, if you want to participate in an event, in a competition, it should be planned way ahead, 1 year earlier, all right, a few months earlier, all right, not only reaching 2 months or 1 month before the training, then before the event, then only you start training. All right, this will increase the risk of injury. All right, and the next one I would like to highlight here is the equipment. All right, equipment, some can be modified and some cannot be modified. All right, for example, all right, the rules of the sports. All right, for example, American football, they need to wear their helmet, right, a body protector, and that is um, something that cannot be changed. All right, that is the rules of the sports. All right. Okay, And next one is the environmental condition. If it's too hot, too cold, or too humid, they will have the effect to the injury risk, right? All right. Next one is playing surfaces. All right, even or uneven surfaces. All right. Playing on the grass, artificial grass or natural grass, or playing on a concrete. All right. This also will contribute to the risk of injury. All right. Next one is psychological factors. All right. Psychological factors also can manipulate, can heighten, or can increase or can reduce the risk of injury. All right. And last but not least, also very important factor here is the inadequate nutrition. All right. This is always overlooked by the athletes, the coaches. All right. By not having a proper and balanced nutrition, it will increase the risk of injury. All right. Next one is let's look at the prevention of sports injury. All right. So we know already the definition, the classification, and factors. All right, that will increase or decrease the risk of injury. Once we understand that, now we can plan the prevention strategies. All right, to reduce the injury risk. All right, and the easiest sports injury to treat is the injury that never happens. All right. What do I mean by this is the injury prevention is the key. All right. All right. So to do this, all right, to plan for a prevention of a sports injury, all right, first we need the information on the what problem that we are facing. All right. This is usually done by the epidemiological study or the prevalence of injury study. All right. We want to know how many injuries are there for each body part. All right. Okay, and once we know this prevalence and the pattern of the injury, then we will study why does this happen. All right, and uh, once we are familiar with this injury and their mechanism, their risk factor, then we can plan for a prevention or management. Okay, and to see whether our strategies are effective or not, then we need to repeat back the process. All right. Okay, so to put it in context, all right, I would like to share with you the project, the research project that I've conducted, right? And this is on the badminton injury. So we look at the data for 10 years, all right, from 2017 until 2007 until 2017. All right, 10 years of data. All right, we look at all the elite badminton player in Malaysia. All right, and we found out that the injury the injury risk is 41.5%, meaning to say that it's closer to 50%, meaning to say that each athlete, all right, they have 50-50 chance of getting injured. All right, that is a very high. Okay, and from that 10 years, there are 1,000, more than 1,000 injuries. All right, 200 athletes. Okay, and we found out that the majority of the injured athletes are male. All right. Okay, and more than 60% of the injury occur during the adolescence age, meaning that it is before 20 years of age, right? More injuries occur during the when the athlete is younger. Okay, and 86% of the injuries are new injury. It's not the same injury that occurring over and over again. No, it's a new injury. First is at the ankle, then at the knee, and then at the hip, back, and so forth. It's totally new injury. All right. Okay, and one at more than 80% of the athletes have two or more injuries. Okay, this makes sense as when they injured a different body part. All right, and almost 70% of the injury occur to the lower limb. All right, first we thought that for badminton player, right, they requires movement of the hand and the shoulder, right, they will have higher risk of injury to the shoulder. But later we found out that for badminton player, even for other racket sports as well, right, lower limb mean the leg and the ankle, the knee, or the hamstring are more exposed to injury compared to their shoulder. Okay, and 94% of the injury occurs during training. It's not during competition. All right, it is occurred during training because of we can say that the number one is because of poor design of the training. All right, and probably they have not enough rest, not enough nutrition. All right. Okay, and next one is the final one is 94% of injury is an overuse injury. And if we have to look at the definition of the classification of the injury, whether it's acute or chronic, right? 94% are chronic injuries, meaning it is because of repetition. It is not because of their fall, not because of uh, 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 what do you call that? The external factor. It is because of the repetitive movement. All right, so that is what happening in our badminton scene. All right, and as you can see, as I mentioned, the most prevalent body part, all right, is the lower limb, which is the knee, all right, and the specific condition for this injury is patella tendinopathy, meaning that is the tendon of the knee, all right, we call as patella tendon, all right, is injured. Okay, and it is not ACL injury, it's not hamstring injury, it's the specifically patella tendon injury. All right, and for the shoulder and for the upper limb, the most common injured body part is the shoulder, and it is the rotator cuff strain. All right, and for the trunk is the lower back. Right? It is very common in our badminton player. All right, and then once we have the prevalence and pattern data, all right, so we do the predictor analysis, and we found out that there are three major predictor of injury. All right, for the upper limb is the age. All right, as the player age, all right, it will increase the risk of injury. All right, comparing from 13 years old to 17 years old, every year they will have increased risk of injury. All right, and males two times more at risk to get injury compared to females for the upper limbs. And if they have injured their lower limb, their leg, all right, they will have higher risk of getting injury to the upper limb, to the shoulder. All right, similarly for the torso, for the back pain, lower back pain, all right, as the player age, again, they will have increased risk of injury. Male have two times more risk of getting injury, and if they have injury to the lower limb, they have 6 times more risk of getting back pain. All right, and for the lower limb, all right, males again have the higher risk of getting injury. All right, and if they have higher they have a shoulder injury, it will also cause them to have increased risk to injury to the leg. Right, and if they have low back pain, all right, they have 6 times more risk of injury of getting injury to the leg. All right, so as you can see that the previous injury, all right, is will cause the future injury. Therefore, the take home message here is once you have injury, you need to properly rehabilitate the injury. Right, you have to complete the rehabilitation, all right, to reduce the risk of getting a new injury. Okay, all right. Next one is the prevention and rehabilitation strategies. All right, and we already understand the what are we facing. All right, the injuries that we are facing. All right, the athletes are facing. All right, and we know why is it happening. All right, now we have to plan the prevention and the rehabilitation strategies. All right, and the most effective prevention and rehabilitation strategies is strength training. All right, but it is not only limited to strength training. The training and the rehabilitation, all right, must be a comprehensive, meaning it is not only limited to strength, it also has to have a cardiorespiratory or muscle endurance, all right. It also needs to have flexibility, right. Athlete also needs to control their body weight, okay. And other than this health related physical fitness, they also needs to train the skills, the technical, all right. Okay. All right, next one is the yeah, as I mentioned, strength training is mandatory. Right, it is very very important. All right, everyone should do this strength training. All right, whether you are an elite athlete, whether you are a weekend warrior, or even if you don't participate in sports. All right, you would like to lead a healthy lifestyle. Strength training is very very important. All right. And for sports that require throwing or smashing, all right, they need to look or give emphasis, all right, to the shoulder strength. All right, as I mentioned previously, all right, in the previous slide, all right, um, the we need to have a balanced muscle between the anterior, the frontal part and back part. Right, in racket sports, all right, that requires a smashing, right, the front part of the shoulder and the back part of the shoulder must be equally strong, right. It must be 90% similar, all right. It is also applicable to other sports, for example, that requires kicking, right, for example football, all right, or sports that require sprinting, for example 100-meter dash, 200-meter dash, all right. The front part of the leg, all right, and the posterior part of the leg, all right, must be equally strong, all right, or similar 90% similarity, meaning that of course we have a dominant and non-dominant side, right. Usually the non-dominant side is stronger than the non-dominant side, right. For example, I'm right-handed, my right hand is stronger than my left hand. It is normal, but we need to control the differences, right. We only allow 10% of differences between the dominant side and non-dominant side, and we only allow 10% of differences between the front part and the back part. All right, if it's more than 10%, all right, for example 20%, 30% of difference, all right, in strength in these two body part, it will increase the risk of injury. All right, similarly for the core, all right, for example, um, trunk flexion and trunk extension, all right. Flexion is bending forward, all right. Extension is bending backward, all right. These two movement, all right, their strength also needs to be similar, 90% similar, all right. Okay, and therefore, all right, I would like to highlight here is very very important to get specialist advice, all right, for your strength training, all right. If you are looking at improving your strength, all right, leading a healthy lifestyle for the athletes, all right, please go and seek coaches or physiotherapists to have them tailor-made your strength training. It is very very important. Okay. All right. Next one is the plyometric training. Right. Plyometric training is basically the explosive movement. All right. For example, sprinting or jumping, smashing. All right. That is a power, and how we train power is by doing plyometric training. All right. All muscle groups should be trained using 1 to 3 sets, right, 2 to 3 times per week. Okay, this is only a general overview of the training. All right, and next one, other than training, all right, we also have a strategies that is very very important to reduce the risk of injury. For example, sleep and recovery. All right, and we come to know that if the athletes, all right, sleep lesser than 8 hours, all right, per day, all right, they will have increased risk of injury. All right, okay. Sleep is very very important, especially to the athlete, but not only limited to athletes. And as a student, for example, sleep is also very very important for the academic performance. All right. Okay, so make sure you have enough sleep. All right, 6 to 8 hours is the recommended hours. All right. In elite athletes, most of the time they have more than 8 hours. If you recall of the number one tennis player Roger Federer, he sleeps 12 hours per day, right? And he said that it is very important for him to sleep 12 hours per day because sleep is part of his training, and that what makes him a number one, right? World number one. All right. Okay, and then on the right side, in the right picture, I have given the checklist for athletes to consider to enhance their quality of sleep. Right, there are a lot of checklists here, the items that you need to meet to increase the quality of your sleep. All right, all right. Next one is the management. All right, this is the updated management. If the athlete or anyone have injury, sports injury, all right, immediate after they have an injury, all right, they need to do this. All right, okay. Previously, we know that every time we have injury, we put ice. All right, um, this is coming from a principle called as RICE or PRICE. All right, RICE is rest, ice, compression, and elevation. All right, rest is meaning you, if you have ankle injury, all right, you rest. All right, you don't use your leg. All right, you just have a rest for 1 or 2 days or even weeks. Right, and then you do ice. You put ice cube in plastic and then you wrap it around your injured ankle, and then you do bandaging and put it higher than the heart level to reduce the swelling. Right, however, this is 50 years old principle. Right, it is not valid anymore. All right, and then 20 years back they come up with a new guideline or a new principle, which is they call as police. All right, protection, optimal loading, ice, compression, and elevation. This is a derivation, all right, from the RICE principle. All right, so instead of rest, all right, they ask the athletes to start walking. Right, immediately after the ankle sprain, the athletes can walk, but with optimal loading. If they can step using the injured ankle for 10% of their body weight, then so be it. All right. All right. But that is the differences between the RICE and the police. All right. Uh, Instead of rest, they ask the athletes to do optimal loading. All right. But the ice, compression, and elevation are still there. All right. But recently, we found out that ice is no longer effective in managing sports injury. All right. Therefore, we remove the ice completely. Now we are using a principle what is called as peace and love. All right, peace and love. No more rice, no more price, no more police. All right, now we are using peace and love. This is how injury should be managed. All right, sports injury needs to be managed. First is protection. All right, similar like optimal loading. All right, in the previous principle, no need to rest. All right, you can still walk, but using crutches. All right, using tongkat. If you can step 10% of the body weight, step 10%, but you still need to use the injured leg. All right, that elevation, all right, must be bandaged and must be put higher than the heart level. For example, if you are lying down, all right, the leg should be higher. If you are sitting, of course you can put your leg higher than the heart, right? But you don't let it hang, all right? You just straighten and put it on a chair, for example. All right. Okay, and then avoid anti-inflammatories and avoid icing. This is very important. No more painkiller medicine, all right, and no more ice. This painkiller and icing will slow the recovery. All right, so no more taking medication to reduce the pain and no more ice. All right, and then again, compression is bandaging and education. All right, it is very important now to educate the injured athlete on the recovery process. Okay, for example, if they have ACL injury, it's very common injury in football. All right, once they have injury, all right, we need to plan for their rehabilitation, and rehabilitation is usually it's 1 year. All right, it will take 1 year to complete the rehabilitation. All right, we need to let the athlete know, all right, that this is the process. If they skip the process, they will have increased risk of re-injury. All right, so we need to expect, we need to manage their expectation. All right, the athletes themselves also needs to know their process, so they don't over expecting their return to play. All right, and then the load is similar like optimal loading. All right, gradually increase the load, all right, to the leg. All right, optimism. All right, now we are considering more mental health. All right, of the athletes. All right, we need to keep their mind positive, all right, to guide them through their rehabilitation. Right, and the other exercise we are including is vascularization exercise, meaning cardiovascular exercise, as well as other exercise, for example, mobility, strength, and proprioception. Right, so these are the new principle of how to manage an injured athlete. Right, but this is only a general overview. All right, each each for each injury, they need to get a rehabilitation from a qualified physiotherapist. Okay, all right. So that concludes the talk for today. All right, I open for a question. If you have any question.
Thank
If
you,
there's,
Mr.
yeah,
Noor.
yeah.
Yes, we will take some questions now. Just a reminder, please type your question in the chat box. Mm, okay, there's a question there from the registration. In 3 day sport, even example cricket teachers cup, how to maintain high level of performance until the end of the event,
All right.
Mr.
Okay. Thank you very much for the question. It's a very great question. All right. As you can see here, all right, uh, the athlete is playing for 3 days, competitive, very competitive event, all right, for 3 days long, all right, and these 3 days long, all right, it's only for the competition. The training should take 1 year earlier, all right. They should slowly build up their performance, all right. The most important thing is the strength, all right, and the cardiovascular endurance, meaning if they have higher aerobic, all right, higher cardiovascular endurance or muscle endurance, all right, they are uh, 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 recovery rate will be faster compared to those who do not train for this cardiovascular endurance or muscular strength endurance, all right. So it's very, very important to train these two things, strength and endurance, all right. And once they have this, they also needs to monitor a lot of other factors, as I mentioned previously. In sports injury, a multi component phenomenon, all right. So they have to look at their sleep, all right, recover as fast as possible. We have a lot of recovery strategies, all right, so they can be fresh for the next day. All right. For example, sleep, very, very important. Nutrition, very, very important. They can also use electrotherapy, for example, TENS, all right, a massage, all right, uh, and also what we call as mindfulness, very, very important. Psychological aspect. So there are a lot of strategies that can be implemented, right? And but the most important thing is the strength and endurance that should be trained 1 year earlier. All right, if it's more than 1 year, it's even better. All right, for example, if you look at our badminton team, right, a Malaysian badminton team, right, when they are competing for 2024 Olympic, they train 4 years earlier. Right, they already identify the players and they train for 4 years before the Olympic itself. So that is how the approach should be. All right. I don't have a very direct answer on what are the strategies to do to maintain the high level of performance during that 3 days, but it's a multifactorial, and I've mentioned to you strength and conditioning, sleep, recovery, nutrition, and training. Okay, I hope I answer your question. Yeah,
Okay, thank you so much, Mr. No. Okay, due to
no problem.
time constraints,
Yep.
so I think that's the only questions that we can
Okay.
answer now.
All right. All right.
All right, okay, before we leave, just a gentle reminder, kindly fill out the sign out form and feedback from after the webinar. It's already pasted in the chat box. Okay, also really appreciate if you can turn on your camera, the participants, so we can take a group photos. Okay. Okay, is there anyone else want to open the camera? All right. Okay, taking now. Okay, 1, 2, 3. Okay, one more. Okay, 1, 2, 3. All right. Okay, that's all, everyone. Okay, thank you, Mr. No. Before we leave, we end this session. Is there anything you would like to cover before we wrap up?
All right. If you have any question, if you need more information, you can just contact me through my email, nohzulfikri@utah.edu.my.
Okay,
Right.
thank you so
Okay.
much, Mr. No.
All right. No
All right,
problem.
great.
Happy.
Thank you for this insightful webinar. Dear participants, please join us for the next webinar titled The Relevancy of Animation in the Industry at 1 p.m. today. All right, take care. Thank you and stay safe.